Mr. Deputy Speaker, sir, we know our young people face pressures on many fronts. There are family and peer relationship issues. Some students impose high expectations on themselves, while others have parents who place high expectations on them. Some students also have difficulty coping with the rigors of our education system. Over and above dealing with the problems of adolescence, they are all learning to cope with the pressures of a competitive, high-performing environment. Previous generations also faced their own considerable challenges, including poverty and war. But perhaps for our youths growing up in today's complex and fast-paced world, their challenges are intensified by what happens online, where comparisons are incessant and unrelenting, adding yet another layer of social pressure. This is why, as a society, we must continuously improve and strengthen our support system to better prepare our children to not only withstand the pressures they face, but also thrive despite these pressures. We cannot shield our children from pressure entirely, any more than we can shield them from the common challenges of adolescence. But we must do all we can to help our children find themselves and find their footing in an intense environment. Our approach should not only be to strengthen the overall system of support, but to engender a much more caring, much more nurturing environment in our society. I will share some of our support measures from upstream prevention to the identification of and the intervention for those at risk. I will then touch on the whole of society efforts we need to support our younger generation. Mr. Deputy Speaker, sir, social-emotional skills and resilience building form the foundation of MOE's mental health efforts and have been part of our character and citizenship education, or CCE, curriculum for some time. This year, we began implementing the revised CCE curriculum starting with lower secondary levels. It includes enhanced features on mental health education designed to develop our students' mental health literacy. For example, they learn to differentiate normal stress from distress and mental illness so that they can seek help before becoming overwhelmed. These CCE lessons also teach them to break negative thinking patterns, overcome social-emotional problems, seek help when they need to, and manage their emotions. Students are also taught how to actively stand up against stigma around mental health issues. Peer support is another crucial pillar in our efforts. All our schools are putting in place a peer support system to encourage students to look out for one another. Our hope is for all students to learn to sit with a friend who is distressed, show empathy and care, and encourage him or her to seek help from trusted adults like parents, teachers, or counselors. Every school has a support network for our students in need. Beyond equipping our students with the basic coping mechanisms, our teachers keep a watchful eye over their students and provide a listening ear. If they notice something amiss, teachers reach out and guide our students to work on their difficulties as they are trained with basic counseling skills. Students who also have access to another group of teachers called the teacher counselors. This is a special group of teachers who have received additional training so that they can help students who are dealing with more challenging socio-emotional problems such as grief and loss. When students need additional support, they can see the school counselor, and school counselors are specialized personnel who provide dedicated counseling support. When students need further intervention and help to access resources in the community, school counselors refer them to professionals such as those in the response, early intervention, and assessment in community mental health or REACH teams or social service agencies. This support network works most effectively when the partnership with the family is strong. Mr. Deputy Speaker, sir, while much is being done, there is always more that we can, we must, and we want to do. COVID-19 has compounded the challenges our young people face. Much of their usual social support networks and routines have been disrupted, leading to prolonged periods of uncertainty, anxiety, and loneliness for many. COVID-19 safe management measures were implemented in schools so that our children can be physically in schools with their teachers and classmates for as much as possible. At the same time, however, we have had to suspend many interactive and community activities like co-curricular activities, national school games, cohort camps, and learning journeys. These activities are avenues for our young people to build bonds and to grow up in a balanced way, both emotionally, physically, and psychologically. We plan to reinstate such activities in full as soon as the COVID-19 situation allows for it. We want to create more time and space for students to pursue experiences that broaden their emotional and psychological horizons and strengthen their resilience. To this end, we want to work with parents and community groups to establish a caring and enabling society that gives greater attention to the well-being of our young. Let me outline the measures the MOE will undertake in the near term. First, we will strengthen the support network in our schools. All teachers will receive enhanced professional development on mental health literacy as a baseline. This will further strengthen our ability to identify and support students in need. We also aim to deploy more than 1,000 teacher counselors in the next few years. This is an increase from the over 700 teacher counselors we have currently deployed in schools. Now, all schools have at least one school counselor, while some have two. Where feasible, we will recruit more school counselors or re-roll suitable educators to augment the counseling support network. For our students, we will bring back CCAs for secondary schools and pre-universities within the next few weeks, as more students complete their vaccinations. We are currently putting our plans together on how CCA can be conducted safely within national safe management measures. We will also dedicate more time and attention to checking in on the well-being of our students regularly. Schools currently have orientation programs for new students at the start of every school year. Henceforth, teachers will devote time at the start of every school term to check in on the well-being of their students and guide them to know how, where, and when to get help. Next, because of the disruptions of learning caused by COVID, we will remove the common last topics from the 2021 GCE examinations. Last month, we had announced the removal of the common last topic for the 2021 PSLE. The Delta variant of the COVID virus has created much greater disruptions than envisaged. and has affected the social and emotional well-being of our students. We are especially concerned for the graduating cohorts so that we will also remove the common last topic from the 2021 GCE, O, N, and A-level examinations. While these topics would have already been taught in schools, removing them from the national exams would help to relieve the revision load and exam stress for our students. Finally, for the non-graduating students, given the COVID-19 disruptions, all schools will also reduce the scope of their 2021 end-of-year examinations to alleviate their revision load.